Well, to respond to these challenges and others on healthcare is one of the foremost experts on nationalized healthcare, Sally Pipes. Sally has spoken to just about every major venue on health insurance. She is the president and CEO of Pacifica Research Institute. Sally is originally from Canada, so she had first-hand experience with universal health care. Let us give a big Silicon Valley welcome to Sally Pipes.
Well, first I'd like to say when Dave Harmer is finished with his political career, I hope you'll join my development team. And I'd like to thank Richard and Jack for inviting me back. I spoke here a few years ago, and the healthcare debate wasn't nearly as important as it is today. What I thought I would do is talk about the two visions for healthcare reform, and then I'm going to talk about the Canadian healthcare system and how that relates to President Obama. Then I'm going to talk about where is reform today, I wish I knew, and some of the democratic options that they're considering, and then I'm going to end up with solutions, how we can continue to make America's healthcare system the finest in the world, because people do come from all over the world. I think everyone would agree, well, I'd first like to say, trying to understand healthcare is similar to unraveling an onion. There are many layers and many tearful moments. I think everyone here would agree that we all want affordable, accessible, quality health care. The question is, how do we achieve that goal? There are two competing visions for healthcare reform. One, which is the vision that I focus on, focuses on patient-centered solutions, empowering doctors and patients, and encouraging innovation in pharmaceuticals, biologics, and medical devices. The other vision focuses on increasing the role of government in our healthcare through increased mandates, subsidies, and taxes. This is what the late Senator Ted Kennedy called his vision of Medicare for all. And it is President Obama's vision as well. I think that very few people realize we do not have a competitive market in healthcare. 48% of our healthcare industry today is in the hands of government, whether it's through Medicare, the program for the elderly, Medicaid, the program for low-income Americans, the state children's health insurance program, and the Veterans Administration program. These politicians in power today, the Democrats, want to take over that other 52% of our health care. How do we achieve universal coverage while at the same time reducing the costs of health care? That is the question. I just want to make sure, can everyone in the back hear? Good. While denying it, the President is on record of supporting single-payer, Canadian-style health care. He said this at the annual meeting of the AFL-CIO in 2003, and he said it again at the annual meeting of the Service Employees International Union. So when you hear him say that he doesn't support a single-payer Medicare for all, he is not telling the truth. Second, there are only two single-payer healthcare systems in the world. One is in Canada, the country where I'm from, and I'm proud to say I'm an American now. And the other is North Korea. Cuba used to be on the list, but they've opened up to some private alternatives. Democratic Congressman Barney Frank from Massachusetts is a major proponent of single-payer health care. But if you saw that TV interview during the summer when the journalist was running alongside asking him what he thought about health care, Barney Frank said, "I am a proponent of single-payer health care, but we do not have the votes to get it done right now. But if we can get a public option, this will be our pathway to a single-payer health care system." And of course, this is what Howard Dean is just licking his chops waiting for. So I thought I would talk a bit about the Canadian healthcare system because a lot of people in the United States don't really know anything about it. And Canadians are lovely people. How could they have a terrible healthcare system? So let's take a look at the reality of universal coverage under a single-payer system such as exists in Canada. And if you want to know more, my book My latest book is The Top 10 Myths of American Healthcare, a Citizen's Guide, available on Amazon.com, just a short plug. It's been downloaded from our website over 1 million times. So I've been very involved with people in Congress, on the Republican side, the Senate, the House, everything. So, but this is my most important myth from my book, that universal coverage can be achieved through a single-payer healthcare system. So let's look at affordability. Michael Moore, in his movie Sicko, where I do have a cameo appearance, he stole a little shot from an interview I did with Bill O'Reilly. He used my little cameo that I did, a program I did with Bill, when Bill asked me, what do you think of the Canadian healthcare system? And I said I don't like it because of long waiting lists, ration care, and lack of access to the latest technology. Michael Moore used that clip to interview Canadians who love the Canadian healthcare system. And he supports the UK system, the French system, Cuba, and Canada, because he says they are all free. Well, Silvio Berlusconi, the Prime Minister of Italy, when he needed a heart pacemaker, did he follow Michael Moore's advice? Did he go to Rome? Did he go to Paris? Did he go to London? Where did Silvio Berlusconi have his heart pacemaker installed? Here at the Cleveland Clinic in America. How many people here have seen Michael Moore's movie Sicko? Isn't it any wonder it wasn't a box office success? And that I haven't received any royalty payments, which my husband keeps telling me I should. The United States spends 16% of its gross domestic product on health care. Canada spends 10%. The President says over and over again that we are spending too much on health care. It's about $2.3 trillion a year. I don't know whether we're spending too much. Perhaps we're spending too little. Americans demand the very finest in health care. Canada spends 10% of GDP on health care because that's what the government says they can afford to spend. That's what government can afford. As a result, Canadians suffer from long waiting lists, ration care, and lack of access to the latest technology. Let's look at quality in Canada. In Canada today, there are 695,000 Canadians out of a population of only 32 million, fewer people than here in the state of California, who are on waiting lists to receive procedures. 17% of the Canadian population, or 5 million out of 32 million, are waiting to get a primary care doctor. The average wait in Canada today from seeing a primary care doctor to getting treatment by a specialist is 16.1 weeks. That is 4 months. How would you like to be told that if you need an MRI and you're having brain seizures, you are going to have to wait 4 months to get an appointment to get an MRI? Waiting lists are a way for government to control expenditures. In Canada, Canada ranks 14th out of 25 countries within the Organization for Economic Cooperation and Development in MRI machines, and 19th out of 26 countries in CT scanners. The country only has 2 positron emission tomography machines.